you're right, this issue could go to surrounding areas. McMinnville has hydrofluorosilicic acid in its drinking water. Kaiser and Salem have a fluoride product in their water. Sheridan has a fluoride product in its water. As far as the other local areas, I think that's it in the surrounding area, but there's always the possibility that it will come to their drinking water. The Oregon legislature over the last 10 to 15 years has tried to mandate water fluoridation in all cities in Oregon with over 10,000 residents. So if the mandate would pass in Oregon, that means if you live in a town with over 10,000 people, say Newburgh, for example, Newburgh has about 21,000 people and they don't have fluoride in their water. If the mandate would pass in the Oregon legislature, they would not have a choice, and there would be fluoride going into their drinking water.
My.
I guess they say that they say that there's a consensus of scientists that agree, or there's a consensus of dentists, health professionals that say water fluoridation is okay. And what tends to happen is that we go on this as public policy for adding fluoride to our water, and what we forget to do is look at the actual product itself. And a friend explained this to me. Water fluoridation consists of two components. You got the actual product, which is, in McMinnville is hydrofluorosilicic acid, and then you have the public policy. How do we get this to the people? Who do we purchase it from? How much are we willing to spend on this product? And so, and also the endorsements. Well, the ADA, the AMA, the CDC, they endorse this product, so it's got to be okay. That's public policy. What we want to focus on is the actual product itself, which we do not have proof for safety. We would like to see a written declaration for proof and safety that the hydrofluorosilicic acid that's added to McMinnville's drinking water is safe and effective. And the only one that can issue a proper declaration for that safety and effectiveness is the manufacturer, who is J.R. Simplot.
And what would it take for him to endorse that?
You know, we had a public hearing on the issue back on November 9th, and Simplot was invited to attend. They were given a notice of the hearing, and they failed to send a representative, or they failed to send in a testimony for their product to defend it. And I've written a letter to them myself, and I haven't received a response. So where can I go to find out that this product is truly safe and effective?
Okay, well, you believe from the research you've done that it's not safe. Is that right?
I believe that, yes, there are many questions surrounding fluoridation that cause me concern.
Can you explain some of these concerns?
Well, for example, the infant warning from the American Dental Association. How many infants are in McMinnville, but yet they are not told that they're not told about this warning, that they should be careful of the water fluoridation. And it would be, I think, a great public service to have that perhaps on the utility bill, warning the residents that if you have infants, choose another water source to mix their formula with. As Dr. Osmundson talked about in the video, there have been studies that suggest bone cancer, osteosarcoma in young boys. How many young boys do we have in McMinnville? There's quite a number, I'm sure. And parents are not aware of this, I'm quite certain, and they're not being warned about this.
And what's the connection between fluoride and lead?
Fluoride is it's a very reactive element. It's in the halogen family, and what it does is it grabs on to whatever it can, whatever it likes, and it will carry what it holds. Like, for example, when we take it into our body, it comes with whatever it's connected to when it's put into our drinking water, which there happens to be a lot of contaminants in there, and one of those is lead. When this hydrofluorosilicic acid and lead gets into the body, it carries that product. It can carry it throughout the body and even into the brain. But I'm not a scientist, so I can't really speak exactly on all of the science, but these are some of the things I've read. And again, if I'm reading these things that it suggests this, I would again like to see from the manufacturer, J.R. Simplot, saying, you know, there's no need to worry about lead in our product. Our product is completely safe and effective for drinking water.
And are you saying the fluoride and the lead work together, or is if we got all the fluoride out of the water, there would still be lead in the water. Is that right?
It's possible, I think, from runoff. I think it's possible from pipes. I think there's lead pipes. The city of McMinnville tests for lead in the water every 3 years. I have certain points throughout the city that they test for lead. But another interesting thing is that there is lead in this hydrofluorosilicic acid that's being added to the water, but yet the city has not tested this product. There's a new product that came in April, and it specifically does have a little bit of lead in it, and the product was not tested, I think, after it was put into the water supply.
Okay, so that's something that it would be nice to see the city do.
Yeah, I would like to see the city, if they're testing for lead on the other end, whatever comes out of the tap, that's fine. If it meets the standards, that's fine. But again, they haven't tested, to my knowledge, since the new product came in April. And again, the city tends to rely on endorsements from trade organizations and from health professionals rather than relying on actual declaration of safety from the manufacturer, again, who is J.R. Simplot.
Okay, interesting. Well, we have a real short video, if we can show that right now. And it has 2 eggshells, and 1 eggshell has been fluorinated. And it's the one on the right side there. And I guess we can kind of liken an eggshell to our bones.
Sure, yeah. A lot of calcium in eggshells.
And so, well, it looks like then the fluoride, maybe will take care of the plaque from our teeth, but also take care of some of the calcium that's on our teeth too,
Yeah.
And that's the problem.
Right, yeah, it actually does the opposite. We hear about how it can strengthen teeth, but it actually can make bones brittle. It can make teeth brittle. When you see the brown, like in Dr. Osmus's video, you saw the brown staining on the teeth, that's dental fluorosis. And what that means is that the children or whoever has dental fluorosis, they're getting too much fluoride.